Okay, good afternoon, ladies and gentlemen. Welcome to Taylor's eSummit 2020. This special session is hosted by the School of Medicine, Faculty of Health and Medical Sciences. My name is Lai Nai Ning. I am a pediatrician, director of clinical campus at our campus, Sungai Buloh, and I will be your moderator for today. Now, the theme for this afternoon's session is Advances in Modern Medicine, Securing Future Career. Now, with me are two persons sitting at high places of modern medicine. Now, they are our in-house experts, in-house specialists on the brain. Now, we have Dr. Lim Suin, consultant neurologist with us, and Dr. Muhammad Jawid, specialist neurosurgeon and senior lecturer in our School of Medicine. Now, they will talk about some general advice on advancing career path in medicine and also share some personal experience. Now, I'll encourage you to type your question in the platform given, so we'll try our best to answer them after each speaker share their experience with you. Okay, without further ado, let us pass the virtual space to Dr. Lim Suin first. Dr. Lim, over to you.
Hi, thank you very much, Prof. Lai, for the introduction. So my name is Dr. Lim Suin, and I'm a clinical neurologist. I'm also currently a senior lecturer in internal medicine at Taylor's University School of Medicine. So since our talk today is on medical careers, I thought it might be useful to start off our discussion with a quick introduction to a typical career pathway for doctors in Malaysia. Just for those who might not be very familiar with it. Okay, so I'll share a slide which I've tried to sort of make as simplified as much as possible. Just bear with me. You should be able to see a slide here showing the pathway, and I start off with, just we've got your 5 years of medical school up here, and that's the typical duration. And after you graduate, you're then allocated a position as a houseman, okay, in a government hospital, which lasts about 2 years. After you successfully completed your housemanship, you will be fully registered with the Malaysian Medical Council, and at this point you become a medical officer. And you might start thinking about becoming a specialist. You might find a particular specialty of interest to yourself. It may be surgical, medical, or in pediatrics or obstetrics. Okay, and there are two ways to go about training as a specialist. You can either do a local master's program, which is offered by university hospitals, or you can sit one of the UK-based Royal College examinations, such as the MRCP or MRCS for surgery, and enter a specialty training pathway here. With that qualification, you can also apply for specialty training in the UK if you wanted to. Okay, and as you know, specialty training takes several years. Okay, and there may be further examinations that you might need to complete before you become a specialist. Okay, and I just said this is the sort of fairly typical career pathway, and I thought I'd just highlight the fact that you could actually choose a slightly different career pathway depending on what you might be interested in. If you didn't want to become a hospital doctor, for example, you could choose to become a GP, working in the field of family medicine, or have a career in public health, or even in the pharmaceutical industry, for example, and these have all their specific training career pathways. There is another important career option for those interested in the field of academia, research, and teaching. Okay, you could consider a career in academic medicine, and this usually requires a completion of a higher degree, such as a PhD or a Doctor of Medicine, which is equivalent to a PhD. And it might take you an additional 3 or 4 years. Okay, you can then still apply to become a specialist. You can actually do your higher degree before or after you complete your specialist training, and this opens up a very rewarding career pathway later on, and you can combine clinical practice with teaching and research. Okay.
Okay, thank you, Dr. Lim. I hope you will get a broad overview of the career in general in medicine. Before I ask Dr. Lim to share some of her personal experience, I would like to encourage all of you to please type in your question that we can, either three of us can answer at the end of both their sharing. Okay, now Dr. Lim, I'm sure many of us would like to hear what is your experience in particular experience in in developing your career to where you are today? Can you just briefly let us know? Yeah.
Sure. Thanks, Prof. Lai. So just sharing a bit of my personal experience, I graduated from medical school in London back in 2004. That's quite some time ago, and I immediately started working with the National Health Service in the UK. So that's the equivalent of the Kementerian Kesihatan Malaysia. So spent 12 years working for the NHS in various hospitals around the country. I developed a real interest in neurology while working at the John Radcliffe Hospital in Oxford, which has one of the leading tertiary neurology units in the UK. And neurology in the UK as a clinical specialty is very academic. And many UK neurologists have higher degrees, such as a PhD or a Doctor of Medicine. And I had the opportunity to do my Doctor of Medicine degree at the University of Nottingham, where I was working at the time. And my field of interest was in inflammatory disorders of the brain. And it so happened that the University of Nottingham had a very renowned magnetic resonance imaging research unit called the Sir Peter Mansfield MRI Centre, which is named after the Nobel Prize winner, Sir Peter Mansfield, who won a Nobel Prize for his work in MRI, because he was based there, and he was still very much active when I was there, while he was still alive. So my research was about using advanced imaging techniques to study the brains of people with an inflammatory brain disorder called multiple sclerosis. And one of the questions I sort of often get asked about is how I, did I know that I wanted to do neurology, early on, and did I sort of really plan for it? And to be honest, I didn't really know what career pathway I had wanted to take while in medical school, and even as a house officer. And I did enjoy a lot of things. At one point, I considered doing emergency medicine. Then it was family medicine. Then it was radiology. And I think that's not a bad thing to be undecided at that stage, because you may not have discovered your area of interest, your real area of interest, until you get a chance to try out different things or test the waters in that particular area. And there's also such thing as being in the right place at the right time, like how I got into my field of research. At the time, they were still developing ultra high field MR imaging techniques. And there were only 2 such scanners in the whole world, and Nottingham had one of them. So it was a very exciting opportunity. So my take on this is, if you're really interested in doing medicine, you will definitely find a lot of things that a lot of different areas that you're actually interested in, and you can probably see yourself doing. And it's not really difficult if you really wanted to do something. It's not really difficult to grasp every opportunity that comes by.
Yeah. Okay, thank you, Dr. Lim. I hope most of you are inspired by her experience. Yeah, and we will come back to you later on when there are questions. Okay, I encourage you again to type question that you may have to try to answer. As many of them. Now, after we had someone, Dr. Lim is someone who used her brain to diagnose other people's brain problem. Now, another person who used his knife, also with brain, to fix people's brain problem. Okay, we have Dr. Muhammad Jawid, neurosurgeon, with us. Now, Dr. Jawid will share with you some very interesting information that he's going to present later on. I'm not going to steal the limelight. I'll pass straight to you, Dr. Jawid. Over to you.
Thank you very much, Prof. Liming, and I welcome all of those who are sitting at the back of the computer and seeing us live. I'm going today to talk about modern medicines, practice in modern medicines. My name is Dr. Muhammad Jawid. I'm a senior lecturer at the School of Medicine, Taylor's University, and as well as I'm a clinical specialist at Neurosurgery Department of Sungai Buloh Hospital. My main area of practice, I'm doing a neurotrauma, I'm doing spinal, and as well as I'm touching a little bit of pediatrics. So I'm going to share with you a little bit of my experience for today's sessions. I hope you'll enjoy it. So my talks for today, I'll be a little bit, because of time, for the constraint of time, I'll run a little bit fast. Part one is basically we're talking about the history. If you're talking about modern medicine, you have to know what's in the past being used. I'll use my experience as a surgeon, and a little bit I'll talk about career pathway in surgery. And to being a doctor, basically I'm doing a lot of international volunteer work. So I would like to share with you a little bit of my volunteer experience, and we will see along the way how does it go. So to look into surgery, the history, surgical skills have been around since the human walk erect. The word surgery is derived from the Greek word meaning hand worker, like a carpenter, and surgeons define the art of practice of treating injuries, deformities, and other disorder by manually you operate and using your appliance. Egyptian was the one, basically, they have put on first hand on surgery. Basically, there's a lot of them, but on 16 BC, Egyptian was the one by splending the fractures, caring of the wound, and drainage of the abscess. Surgery was progressively claimed and become much more scientific in 16th and 18th century. One of those instruments I would like to show you, which was invented in 1573, which is like from now onward, almost like 400 years back, called Hodgson brace. This is one of those fantastic instruments that we're using in surgery, even in neurosurgery nowadays, in Sunaybulo hospitals, and those hospitals in least developed countries will not access to electricity using the thing to opening the brain. Apart from that, during the Turkish Empire time, Byzantine times, also using a lot of instruments. This is very primitive instruments while using in surgery. And this instrument is to stopping the bleeding and to opening the brain. And this is like very, very primitive. So to take it from that one, what advances we have it nowadays, I'll share with you neuronavigations and modern medicines, which we're practicing in Sunaybulo hospitals. What is neuronavigation? Neuronavigation, to make it very simplified, it's a computer-based optical brace camera systems. While we're doing MRI and CT scan of the patients, after that, when we bring the MRI and CT scan, we upload it in the systems from 2D. This machine will be converted into 3D. What we do, the machine itself, while we're putting in a machine to upload the scan, so the patient's coming in operation theater, we just through infrared or through markers, we just like scan the head, and you can see the whole head will be scanned. When we scan the head, the 2D converted into 3D in real life, like some sort of mixed reality. So we do have a pointer, we do have a camera, we have a computer, and this adapter. While we're moving the pointer, basically you can see the tumor, and by this instrument or by this machine, we can localize even the tiny one. Basically, do this here. One of my patients, I'm operating in this, the gadget of neuronavigation. I'm not going to talk, but in a short while, I want to show you one of my patients actually. So this is one of the patients. It's a 47 years old teacher referred by neurologist by the history of seizure and visual disturbance from Sunaybulo Hospital. While the patient come to us, if you look in the patients, he has got a tumor in right parietal region. This area is really important from neurosurgical prospect. For us, basically, if you open in the brain is like really complex structure. You have to be extra careful to not damaging the patient, and you have to be safe in and safe out. I'll show you this patient's a little bit. I think the viewer discouraged. If you're afraid of blood, I'll just show you this videos. Just be with me. And this is basically while we're operating, so we're taking informed consent from the patient. I'll take informed consent. And this is the patient basically in operating tables. While putting the patient in operating tables, the head of the patient is fixed to the Mayfield clamp. This adapted is the pointer. While I'm moving the pointer, you can see that in a short while, basically in real life, the brain is basically also is localizing the tumor. When I'm moving in real lifetimes, we're operating these patients. Once we localize the tumor, we mark the tumor. A little bit, I'll be run fast. So we're marking the tumor. This on right side. We mark it on the right side, and after that, basically once we mark, we're opening the head, and this is, you can see the brain on that side. So what we do, we're opening the brain in very careful patients. This is magnified view. You can see on the screen. This is almost like 300 times magnifying the vessel. Actually, naked eye, you cannot see even this vessel. So what I'm going to do, I'm going to cut through the brain. Once I cut through the brain, and after that, this is the area of the tumor. It's almost like few millimeters. Basically, it's near impossible, basically, to operate and localize this tumor. So this machine is like a GPS, safely taking us through the brain and getting us out of the brain safely. Once we take out the tumor out, what we do, we just close the brain, we're putting a few plates, and after that, The patient's going to ICU. Once the patient goes to ICU, this is the post-operative MRI. This big hole here, the tumor is out, and this is the patient on day 2 of operation. So safely, no neurological deficit. We're going in and out safely and go. Another thing, basically, also we're using in Sungai Buloh hospitals, basically, I want to show you, this is the latest technology we use it in Malaysia. This is called the tumor. If I ask anyone of you where's the tumor, basically, you don't know, but we color code the tumor. We're giving some oral solution to the patient, and the patient will have it, and the tumor highlighted like this, and it's make our life easier. So another path of mine is going to talk, it will be on basically career pathway. I think Dr. Suin is talking in general, but I will a little bit touch on the career pathway. Like a lot of misunderstanding will happening through the career pathways. The media, social media, television, everything. There is a lot of house like scrap and everything. The people thinking that the doctor life is cool and so relaxed, but the reality is not what you see on the media. A little bit I focus on medicine. To being as a doctor, I focus on to work as a volunteer. So each year I'm going internationally volunteer. I have worked in Afghanistan, Pakistan, Malaysia, Indonesia. And this part of my work was in Africa, Nairobi. It was a fantastic experience, which on the first day of my life, I just found this lady, the hand I'm operating in the hand of this lady, something called compartment syndrome. And I saved, luckily, his hand. And that was the rewarding of the day. And we have a lot of patients, like, you know, this beautiful beauty kid is waiting for me. I'll just give him every day. And Kit Kat. So apart to doing your volunteer work, I think you see the world integrate with the people. While you're sitting on your own shell, I think you never had such a fantastic and magnificent experience. So I think I put this one, life is going on. I mean, you have experience, but of course, along the way, you should like transfer your experience to your offsprings who will coming to you. And basically, along the way, you have to share your experience with them.
Okay, thank you. Thank you, Dr. Jawed. Wow, I'm sure many of you will be wowed by his inspiring life in the hospital and out, okay? Now, I encourage you, the questions coming in, I encourage you to type in questions for either of the Dr. Lim and Dr. Jawed. They have so much to share with you. So, now I think it's question time. May I just get the first question? Now, this is an interesting question, very good one. I think maybe I direct to Dr. Lim Suin first. Question is that what do you think about having a gap year, a researcher, this kind of time after completing undergraduate degree before becoming a houseman? Now, as you know, we nowadays all the medical students after they graduate, they have some sort of a gap year waiting. Replacement, but this is different, doing a research. So Suin, what do you think, having a gap year? You've done some research in your career. Over to you.
Thanks. Yeah, no, I certainly have done research, but no, I've never taken a gap year before. You know, I never took a gap year before I became a houseman. And there are two things to really consider when it comes to this. Well, in Malaysia, you've got your involuntary gap year, so you haven't really got a choice. So while you wait to be given a position as a houseman, some of us might be waiting 6 to 12 months. And those more productive will, and many do actually, so many of them, before they get their housemanship jobs, they come back to the university and they join their lecturers to do some research and get some publications out of it. And I think that is a really good use of that time that would otherwise have been spent literally maybe not doing very much. So that's one thing. I think that's a really good opportunity, given that most of our housemen haven't really got a choice and they have to wait in that 6 to 12 months. That's a really good opportunity to work on your CV. So it may be a small research project. It doesn't have to be something big. Yeah, you can work with the lecturers that you knew very well at medical school. You can come back, you can do a bit of tutorship. You can also get involved, if you hadn't already gotten involved in a lot of this, but you can also get involved in community health projects, social projects such as charities, or do specialty attachments maybe in an area that you think you might want to eventually specialize in the future, or just an area that interests you. So I do advise you, if you are faced with this sort of gap year, gap 6 months, to make the full use of it, okay? Because when you start working as a doctor, time is a factor. So just getting enough time to do all the stuff that you should be doing, or you want to do, to build on your CV, to help advance your career in the future is a bit more difficult. Okay. It's also a great opportunity to start studying if you were inclined to take one of the Royal College examinations, MRCP and MRCS, or even the USMLE, which is the US medical entrance examination. And you could spend that time working towards those. So do make it productive. If you weren't faced with the gap, I mean, I personally, the downside to that sort of having that gap is, of course, you do very quickly de-skill in your medical knowledge and in your practical skills. And so that's something you do, you just do have to be aware of. After 12 months, a lot of us might forget some very basic anatomy, so you do have to keep studying. And that's one problem with that. Okay.
Yeah, thanks. Yes, I echo Dr. Lim's comment here. I think having some research experience and output will be very important in the determination of the career path in the future. What differentiate you from others may be a good paper that you have gathered in your gap year and experience built up. You find that you won't have a lot of time when you're doing practice when you actually started work. Now, great, we have question coming. That's great. So the next question, keep typing in. We try to answer your question. The next question is a huge one. I think I'll pass this to Dr. Jawed. It's a very general one. You can have your take. The question says, what is the future of medical doctors like in Malaysia? So I like your take, just your take on it. Okay, Dr. Jawed.
I mean, the future of medical, not only in Malaysia as a whole, basically, I think this is the path you selected. But if you're coming specifically to the doctor like future in Malaysia, I think the future of doctor in Malaysia is great. It's a bright. But the piece of advice to be given before coming to medical school, you have to know like why you're coming to this path. Why you're coming to medical field, because once you come to medical field, you have to be commitment is like 100% commitment you have to put. But if you're looking from future prospect of medical or medical field in Malaysia, I think your job is secure. I mean, we are living during coronavirus like a pandemic. Basically, there's a lot of need for the doctors. But to being a doctor, you have to decide it like what sort of doctor you want to be. So I think Malaysian doctor has a great future and great opportunities. Yeah.
Okay. Thank you. So thank you, Dr. Jawed. I think it's not all gloom and doom. Actually, you see, we are people like us in the field do have some optimism, regardless of what comes. I think Dr. Jawed's answer reflects that. Now, along with that question, a similar one. Yeah, I'd probably pass it back to Suin. What does the future of work look like for graduates post-coronavirus? Suin?
Thanks. Interesting question.
A brief one probably for the sake of time. Yeah, Suin?
Yeah. So interesting question. To be honest, I don't see our future work or the nature of how we work changing very much. But I think what we are seeing is, so what a lot of countries are doing in terms of medicine is they are sort of leaning towards providing a safer service for patients. Okay, so a lot of countries during the peak of the pandemic switched over to telemedicine. And a lot of them, a lot of hospitals in the UK have an IT system that can be accessed by doctors in their own homes. So it's a secure IT access. So I think using technology is becoming more important in medicine, and at least I think thinking about patient safety from that point of view is going to be important. So that particular nature of work might change, but otherwise I don't think our career pathways as such will be very different.
Yeah. Okay. Thanks, Suin. What a concise. You can also see the optimism that reflects our resilience. When people still get sick, we will still be there, no matter what happens, virus or not. Yeah, there will be wave of pandemic coming, but we stand a place in time. So I think this profession is there's pride and there's satisfaction in us. So I think time runs very fast. I hope you all enjoy the information from the session. There's so much more we'd like to tell you, but there are many other good things I think in the e-summit that you should go to. So I would like to thank you, all of you, very much for listening and for the good question that you asked. And we hope we have provided you with something that you can take home and work on. And I'll urge all of you to continue the e-summit by joining either our counseling session or more importantly, by taking our virtual tour of the Faculty of Medical Health and Medical Sciences. Hopefully you will see something that you like very much and hope very much that we will see you physically, yeah, when this is feasible very soon, yeah, when you come to us. Yeah, with that, I will thank you, or I thank the speaker. I hope you join me in thanking Dr. Lim Suin and Dr. Muhammad Jawid and inspiring words and for their time in sharing with you. I think we thoroughly enjoy sharing our experience with you as we always do, and we enjoy answering your question. And I think there's so much more they'd like to tell you. This is the third time I told you. I think we are happy to answer your question out of this section. Okay, thank you very much.